right, that video, courtesy of bassist Adrian Jerks Henry and a cover of Stevie Wonder's Don't You Worry About a Thing. So for a number of years, nurses across Jamaica have been battling with issues relating to wages and staff shortages. But since COVID-19, the issues have become bigger and in some cases more life-threatening. Nurses are on the front line trying to care for patients battling the COVID-19 virus.
Now, the issue is who cares for these caregivers working tirelessly to keep patients alive, and how are they managing? Here to share more is President of the Nurses Association of Jamaica, Mrs. Patsy Edwards Henry. Madam President, morning. Welcome to Smile Jamaica once again. How are you?
Good morning.
Good morning. I am good, relatively good.
Yeah, great to have you
Not
with
bad
us.
this morning. Have weathered the storm. And good morning, Dahlia. Good morning, Neville.
Fantastic. First, condolences. I know you lost another nurse. I did not know because just this morning I read that Nurse White Best became the fourth nurse reportedly to have died from the coronavirus related complications. I did not know that. So again, condolences. How are the nurses?
Thank you very much. We'll pass.
Yeah, please. How are the nurses coping with all of this?
It's a rough journey. It's hard. Psychologically, a lot of the nurses are not coping very well. When the day after she died and we tried to get in touch with Percy Jr., the nurses were distraught. I'm not sure if you heard the voice note when one nurse said, "We are expected to turn up and we are not okay." So the challenges exist because, as I say all the time, we have a death in our family. We have a business. We work within an institution, but it's not one of those institutions that you can put up a sign that we are closed for today. Sorry for the inconvenience. It is the same people who are grieving and have had the loss who have to continue to come out, to get up, dress up, show up, and to be there. And it's really not easy. It's difficult.
As we said at the top of it, nurse, there have always been concerns about working conditions, wages, and so on. But since COVID-19, let's prioritize. What are some of the top issues now that you feel have to be addressed for the nurses to continue?
COVID has shown that there are no systems in place for healthcare workers. The healthcare system was not ready for an outbreak of this nature. So our resources, the amount of money that is put into healthcare, we need to reconsider as a government and as a nation. We really need to start putting some money into healthcare. So when COVID came, we needed a number of resources, and that came at a cost, but we started getting it slowly, but it started coming. The healthcare worker is referred to as casualties of war. We are warriors. We are on the front line. And in every institution, a lot of organizations, they have things in place for their workers. As a casualty of war, there is no way that we should be on duty, on the front line, and nothing is in place to care for that casualty of war. And while I say that, I'm saying it shows that the healthcare system is weak and is lacking, because we have tried on a number of occasions to reserve, as some persons would want to say. But if I have 3 ventilators, I put 2 into the general populace and I keep 1 for the nurse, or I keep 1 for healthcare worker, and your relative comes in or another relative comes in, it's going to be difficult for us as healthcare workers to know that we can and we don't. Yeah. So even while we say that, it all comes down to having enough that we can, at any point in time, care for the ones who are caring for you.
Yeah. I hear everything that you just said. I want to read 2 things in preparing for this. Her name is Annette White Best. The nurse was based at the Percy Junior Hospital in Manchester, a secondary type C facility that in her dying days, colleagues said was unable to provide critical oxygen for one of their own. It says after multiple attempts at relocation, she was transferred to an already stretched type A university hospital on her birthday, August 9, and she died 2 days later. All right, having said that, you're quoted as says, I don't want to say priority must be given to us because everybody is important and all lives matter, but there needs to be systems in place to care for the carer. You just spoke about that just now, but if priority is not given to the nurses when they're sick, who will look after us if the nurses can't work? So shouldn't priority be given to the nurses?
You see, sometimes you have to try to be politically correct. Priority really should be given to healthcare workers in the healthcare sector. You work in a system that should be able to care for you. But sometimes when you say priority, persons think you want preferred treatment. I'm not saying we should get preferred treatment. I'm saying that a system should be in place that when a healthcare worker, a nurse, a doctor, whoever it is, falls ill, especially in the line of duty, you should be taken care of with some urgency.
Nurse Patty, I'm listening and I'm thinking, I think maybe if, and I guess this is a little bit utopic. I mean, if the system was great in the first place, we wouldn't have to be worried about anybody being sick, whether a healthcare worker or not, because we would have had more than the 3 ventilators. So I want to ask, in terms of what's happening now, do you guys have enough resources in terms of your gear that you have to wear when you're taking care of patients, particularly COVID patients? And I know that in some places overseas, nurses who deal with this situation are given hazard pay. Is that something that you benefit from, some kind of additional payment for putting your lives at risk in this pandemic?
The truth of the matter is we have never, and we hardly ever have enough resources in the healthcare sector. We now have PPE. We're not too short on PPE. The government has tried to get that, but we're not. It's not just PPE. It's other things. We really are short on resources. We need a lot more ventilators. We need a lot more beds. But we really don't have anywhere to put the beds either because we need spaces. You would have heard on the news that we have patients being nursed under tents. And that's a difficult situation. When COVID just came last year and we had the fears and persons were working within the areas, there was one point in time when the government was paying $3,000 per day and they called it a COVID incentive. That has since stopped. That and we had to struggle to even get that incentive, and they would have to audit and they would have to justify, and they sent out a lot of things. We had real challenges just getting the incentive because you had to write. At one point in time, they wanted you to even write down the name of the patient that you cared for, while nurses were out there in the communities, in the schools, in the hospitals caring. That incentive has since stopped. So even although we're having the second and the third wave, the incentive has stopped. And no, we're not getting anything, just the stress.
Yep. Final
and
question.
the pain.
Final question
of it.
from me, Madam President. 65% of healthcare workers took the first dose of the vaccine. 40% for those have come for the second dose. What is your word to them? Should they all take it? And I read where you said that some people have comorbidities, and that's one of the reasons they're waiting to hear what their doctors are saying. But what are you saying to your nurses? Should they take it? Should they not take it? What are you saying?
I'm encouraging all healthcare workers, in particular nurses, and I've said this over and over again. The vaccine, we are a country that lives and thrives on vaccines. We have been giving vaccines all our lives. And as a result of that, we have been able to avert a lot of the challenges, the illnesses that are preventable by vaccine have been averted. Some have become extinct. I have always maintained that healthcare workers should take the vaccine. It is not mandatory, and it's not mandatory yet, but I do believe that as we care, if there is anything at all that will help us or prevent us from becoming seriously ill and or dying, I encourage it. So my word to healthcare workers is let us get vaccinated. I do know that the second dose, the number is a little down because some persons took it at various times. So you would find that some of them are not really due to get their second dose yet, but they're coming on board. I'm in the process of doing a survey now. Based on the results, 72% of nurses have taken their first dose, 67% the second. So I'm looking forward to having that number increased, to have a lot more nurses come on board with the vaccination. But I'm encouraging persons to go out and take their vaccine.
Okay. Once again, on behalf of all of us, thank you and your colleagues for what you've been doing. And again, condolences to you and your colleagues for your losses. God bless you. Stay safe.
Thank you, and thank you for having me. And remember, the vaccines are here, not just for healthcare workers, for everybody. I encourage everybody, vaccinate to stay safe.
Nice. Thank you, Nurse. President of the Nurses Association of Jamaica, Patsy Edwards Henry.
After the break, we look behind the lens with a young professional